So thank you very much for this nice introduction, and I'm very glad and happy to be with you and the participant and the panelist here. To start, give you a small introduction about the TeamSTEP, the program that I really love, and actually it's important for me and for many others in healthcare services that if they use and implement it can change and drive them to better care for their patient. I'm just I'm just presenting this as an introduction for the TeamSTEPPS. What's TeamSTEPPS? How can we implement TeamSTEPPS? What's the impact of the TeamSTEPPS in our services? I'm talking to you here from Mecca in Saudi Arabia. I'm working in Security Forces Hospital, and we are serving like big geographic area in this hospital. And actually, we started long ago to implement TeamSTEPPS in our hospital to improve the patient services in our hospital, because our vision is to be recognizable as a leading hospital and to be the first choice of healthcare provider for our clients. And the TeamSTEPPS was one of the tools that we use to implement to improve our patient care and to improve the outcome of our services. So a question here, what's TeamSTEPPS? What do we mean with the TeamSTEPPS? If you have a question here, I will propose it to you and I want you to answer. So could you please raise the question? So the question saying, what do you think about the order of annual death in the United States in 1990? What's the main cause of death, leading cause of death in the United States? Okay, so I can see that you are almost going toward the right answer, which is the medical errors. And this is actually surprising to me that you get the answer, because medical errors is a leading cause of death in the United States, as you can see in the screen here. So the first cause of death in the United States is medical error, followed by other causes. So if you can go here and see that about 44,000 to 98,000 annual deaths in the United States happen because of the medical errors. And this, for us as a medical or healthcare provider, should make us to take a step back and think, how can we prevent this? The second cause of annual death is the car crash, followed by breast cancer and other causes. So as a healthcare provider, if we think that we are, or the medical errors is the leading cause of death in the United States, this mostly applies to most of the countries worldwide, and this needs to be addressed. One of the most important tools I found it's very helpful in my career and in my work throughout the last 25 years is using or implementing the TeamSTEPPS. So a question here I would like to ask, and this came as an important question to all healthcare providers, what is the barrier for team performance? Why the team is not performing well? There are many reasons, and it can be summarized as follow. Inconsistency of the team membership is one of the causes that can lead to or to hinder the team performance. Lack of time. Most of the healthcare providers are very busy and they don't have time to communicate properly. Lack of sharing information between the team member. Hierarchy should be a barrier. Sometimes the superior and the subordinate, they don't have a proper communication or communication tool. Defensiveness. People in services, sometimes they work defensive, and this can be a barrier for team performance. Conventional thinking can be a barrier. Varying communication style can be a barrier, or if there is a conflict between the team member, this can work against the team performance. And lack of coordination and follow-up is another important factor that can affect the team performance, and distraction that can come from the busy work or the overwhelming with business or busy duties, and sometimes fatigue because we are working day and night, and sometimes we get fatigued and we are not communicating properly between the team member. So this can be a factor that can affect our performance, and workload is an important factor, or misinterpretation of the cues or the information that we receive, sometimes because we are overwhelmed with business, sometimes because we are not focusing or concentrating, or lack of the clarity of the role of the team member. So the team member are not assigned properly and they don't have a full orientation about their task or their part in the team, what they should do. So all these factors play important role that can affect the team performance. And we will focus over the coming 2 hours, how can we improve the team performance? So TeamSTEPPS is a set of skills that if you learn it, it will help you to improve your performance, it will help you to improve your knowledge, and it will help you to improve the attitude and behavior. So these set of skills can be learned and can be a tool you can use it to improve your performance. So what's TeamSTEPPS? If you can decompose this, you will see that it is a strategies, it is a tools, a set of strategies and a set of tools that will enhance performance of the team to improve patient safety. So what you will learn is a strategies and tools that you can implement in your real life to improve the performance of the team. So let's take it one by one. So what's the skills? The skills you will learn today is about the communication, how to improve your communication, how to improve your leadership part, how can you do a situational monitoring and analysis, and how can we support each other. So the mutual support is the fourth skills that you should learn. All these will help you to improve performance, will help you to improve the knowledge, and it will help you to improve the attitude. What do we mean with attitude? Is the feeling you're feeling when you are doing the task. Skills is helping you to improve how can you do things differently in a proper way to improve the performance. And the knowledge is the cognitive understanding of the task. All these skills and the sets of tools will help you to improve the performance, and ultimately it will help you to get a better patient care and better patient outcomes. So these tools and strategy, in summary, if we can summarize it, is a set of barriers as we described before. And these set of barriers will give you some tools and strategies that can be used in your daily practice to improve your performance. For example, SPAR, and we'll talk about it, callback, checkback, and handoff. All these types of skill you will learn today, and you can reflect it tomorrow in your practice. This will help you to improve the outcome and improve your performance and your patient care. It will help you to start shared mental model. It will help you to adapt within the team, and it will help the team to be oriented and to know each other more, and then we'll build up a mutual trust and improve the team performance, and ultimately it will help to improve patient safety. So what's TeamSTEPPS do for us actually? So for example, in our hospital, let's give you some examples. How did we improve our services in the hospital? We use SPAR, and this SPAR, a technique that you will learn about it, so talking about the situation, background, assessment, and recommendation. And most of you, I think, you know about this. When we implement this tool in our hospital, it helps us to reduce the adverse drug events from 30 to 18 per 1,000 patient day. Another example is medication reconciliation. In admission, we improve it from 72% to 88%, and on discharge, we improve it from 53% to 89%, just by implementing simple tool, which is a SPAR tool. In the operating room, when we implemented this, implement the briefing technique, it helped us to improve the time of prophylactic antibiotic prior incision in the operating theater from 84% to 95%. And again, in operating theater, it helped us to to convert the prophylaxis for DVT from 92% to 100%. And also it helped us to in 19% increase in OR employee satisfaction rate and 16% reduction of the nursing turnover in the operating theater. All this by implementing simple tool through TeamSTEPPS strategies. And in labor and delivery is another example. We have 50% reduction in the weight adverse outcome score and 50% decrease in the severity score index. All these improvement, we have it in our hospitals just by implementing the strategies of TeamSTEPPS. So another example is medication error. Using XBAR again help us to reduce it from 25% to 3 per 1,000 patient days. And this is again an example that when you implement the TeamSTEPPS strategy in many variable areas in your practice, that can help you to improve patient safety. Taking to a bigger scale, improving the TeamSTEPPS in our hospital help us to improve the results of the patient safety culture survey. In 2015, we were in 57%, and now in 2021, we reach up to 83%, and we are looking for better performance in next years. So simply, this strategy is applied in many areas in our hospital, help us to improve and to secure our patient care, aiming for the best of our patient and to improve patient safety. So what makes it different? Why TeamSTEPPS is different from other strategies? It's because of many factors. The first and most important one is basically evidence-based type of tools that can be implemented. It's comprehensive, covering many areas in the healthcare services and easy to implement once you learn about these simple strategies. It's customizable, so you can customize it according to the services you are providing in your institute, and it's easy to use. Simple strategies that easily describe, and once you learn it with your team and implement it in your practice, it will help you to improve the patient care. The most important thing is publicly available and it's free. So you can get it from the website of HRQ and then you start to implement it in your practice. Simply for this reason, it's a tool that I would say one of the best tools that you can simply use it and simply spread it in your hospital and implement it everywhere to improve the patient care. So this is the part of the introduction, and I will now take you to Dr. Ahmed al-Sheikh in the next part where he will talk about the team structure.
Thank you, Dr. Khalid. My pleasure to be here with you and my pleasure to be here with all of our attendees. So today we are going to continue. Okay, so what is the TeamSTEPPS? So how can we implement it? When you talk about TeamSTEPPS, the first word is team. So the right start is start from the team and say, okay, so what is the team structure? I'd like just to take you to a simple math equation. So 1 + 1 = 2. This is simple. My question is not that. My question is, can 1 + 1 = more than 2? It's simple math. Use the chat if you wish. No. And yes, some no, and some yes, and some could be. Okay, so the answer is yes, but just in one condition, in the teamwork. So if I work alone and you work alone, suppose if we are working in a team, the synergy between us will lead to an impact that's higher than the work of every one of us separately. So this will take us to a very important question. What is the difference between the group and the team? When can we say that those people are group or those people are team? Again, use the chat. Because not because we're working in one place or because we're working in one entity, this means that we are a team. Group not necessarily working collaboratively, that's great. Team is working together, common goal. Team have a goal. Thank you so much. Thank you for your participation. The team is working for a goal. The group is not. So if some people are sitting beside each other, this is a group. But once they work together towards a common goal, as we see here to the right, this is the team. So the team structure here is very important because the team is, if you don't have the right team, you cannot expect to have the right outcome. Understanding the structure is a key in order to understand how multiple teams interact. We're not only talking about a team, we're talking about a hospital in healthcare setting. It's very complicated. So what defines a team? The team is two or more people interacts dynamically, interdependently. Everyone is working even solo, but by the end of the day, the goal is common and there is common and valued goal between these members. Every team member should be involved in the process of care, at least the process that you're talking about. You should have clearly identified and defined rules and responsibilities. They should be accountable for their action and must stay continually informed for effective team. Why, to take it in a theoretical way, why don't we start to talk about the team stages? This team is going to go through stages. These stages are very famous. This cycle is very famous. The forming, storming, norming, the forming, and adjourning. Think of your team. Think of the unit of nurses, physicians, pharmacists, and all who are taking care of the patient. Once they start to work together, or even an improvement project that you're working on, a team that you're working with, once they start to work together, they start to form, establish ground rules, just identifying and get to know each other. In the second stage is the storming. They may get to conflict. They still have strict individuality. You should intervene here in order to catch to the next stage, which is the norming. They start to bond. They start to have acceptance of others' perspective. And now they reach the most important phase, which is the performing. Now they start to depend on each other. Now they have more flexibility to accept each other until they reach to their goal and to go for adjourning. I have a very important question here. If we say a team in a hospital, who are the members? You have some clues, but there is one important member missing. Who is the member who is missing here? You can use the chat in the Zoom. Yes, it is multidisciplinary. Sure, definitely. I see some good answers. I see some experts giving the answers. Okay, thank you so much. Yes, the one is missing is the patient. Without the patient, this is not a team. The old concept of, okay, the healthcare givers team or the hospital team is the physician, the nurse, the pharmacist, and that's it. This will hide a lot of very important information and will limit the value of this team and the impact of this team. Your patient should be on board. Your patient shall be engaged. And the TeamSTEPPS is part of these initiatives that will lead to the patient engagement. We started to talk about the patient-centered care and the human-centered care. And if you follow the new standards of SBAHI, it's talking about the human-centered care. And this is very important to have the patient in the center, and all of us, including the administrative team, is working towards the patient. There are lots of other initiatives that are on that you can start to implement. We will just give you hints about the names of the initiatives that you can work on, such as the some strategies, including the patient's bedside round. Start to discuss with your patients, conduct hands-off at the patient bedside, provide the patient with tools for communicating, empower your patient, be very keen to have knowledgeable patient, involve the patients in key committees such as the patient experience and so on, and actively enlist these patients' participations in order to work on. Some examples such as the patient engagement executive walk-arounds, thank you so much. Some initiatives such as the Speak Up initiative from the Joint Commission is a very nice one. Ask Me 3, that you encourage the patient to show what are their main problem, what do I need to do, and why it is important for me to do this. Yes, the patient surveys, the patient satisfaction is a very important tool, another very important tool. By the end of the day, do not forget to have the patient on board with you in the team. There are multiple teams. Actually, the work in healthcare is very, very, very complicated. You have the administration as a team, you have the coordinating team, the ancillary and support services team, the core team, and all are towarding into the patient. Yes, the shared decision-making model is a very interesting tool that you can utilize for the patient. Thank you so much. Really, you are enriching the session tonight. Starting from the core team, yes, this is the team that you expect. This is the team that directly interfering with the patient. It should be there, and they should involve the patient, and they should have a point of assumption from the point of assessment to the point of disposition for the patient. And there is a contingency team that if in case the patient needs additional care or a care at the moment of time, think of the contingency team such as the Code Blue team that may intervene for a moment of time. This team should again be part of your training for all the steps that we're going to talk about. This is the importance of this part. You should know where should you direct the message to. Another important team is the contingency team, including the coordinating team as well. The team, these are the teams are working for the facilitation of the work of the core team, such as the charge nurse, the unit clerk, the administrative team will come later. The ancillary and support services is very important. Again, layer of team that should work for the patient, such as the lab, X-ray, pharmacy, housekeeping, CSSD, and so on. And finally, the administration. As you see, there are layers from the patient in the center, core team, and contingency, coordinating, ancillary, up to the administration. Finally, let me show you a very brief video about the value of the team and what should we do for those members. I hope that you enjoyed this video demonstration, and this will help you to differentiate between different team members according to their attitude and what should you do. My pleasure in the coming, this is the end of the team structure model, and my pleasure to introduce my colleague, Dr. Mohammed Tawansi, who's going to continue the journey with you and take you through the communication and the rest of the models. Dr. Mohammed.
Hello, everyone. It's my pleasure to be here with you from all over the world. Thank you for attending. Thanks, Dr. Khalid, for the amazing introduction, and thanks, Dr. Ahmed, for the amazing session about team structure. As you just heard, that TeamSTEPPS is based on more than one dimension. It's based on team structure, communication, leadership, mutual support, situation monitoring. While these are all very important, but communication is very, very important. It's the cornerstone. It is the linchpin that holds all these dimensions together. So I need now to discuss with you the objectives of this session, to describe how communication affects team processes and outcomes, and to define the effective communication, also to identify communication challenges and barriers, and then to identify the TeamSTEPPS tools that can be used to overcome these challenges and barriers. So what's communication? As we just said, that it's a cornerstone and linchpin. Is effective communication skills are very, very vital for patient safety. So when you are working in a team, you cannot work towards patient safety without proper communication. Any problems in communication can endanger and affects badly patient safety. Also, it enables team members to effectively relay information, and it is the mode by which most of TeamSTEPPS strategies and tools are executed. So I need to ask you a question. What do you think? The Joint Commission identified that the problems in communication had an impact on the patient safety, especially the sentinel events, with certain percentage. What do you think this percent is? How do you think the ineffective communication can affect is the cause of the sentinel events? Is it 1/4, 2/4, 1/3, 2/3? What do you think? Can you answer me in the chat? Thank you. So it's 66%. It was identified as a root cause for nearly 66% of all reported sentinel events. Yes, correct. Thank you. So the communication is the process by which information is exchanged between individuals, not only in hospitals, in all our life. Also, it's effective when it permeates every aspect of the organization. So what's missing here? What do you think? We have a provider, we have a receiver. What do you think is missing here? The message or the input. Okay, very good. Is this clear or not yet? Closed loop. What can make it a closed loop communication? What's missing here? What do you think? Feedback. Amazing. Thank you. Thank you. Amazing. This is feedback. We have here lots of experts in our session. Thank you. So I need you, please. Now I'm going to share a poll with you, okay? And I need your answers, okay? So in face-to-face communication, meaning is received more from, what do you think? Now, oh, okay. I'll give you more 10 seconds. Okay, we have lots of answers. Okay, 5 seconds to close the poll. Amazing. Okay, I'll share with you your results. Okay. Okay, so now we will show you the correct answers. So what is for 55% for delivering the message is the body language and body movements, the face, the arms, while 38% of the message can be delivered through the voice tone, the modulation, the pauses, while only 7% of the message can be delivered through the words. We can also, regarding the verbal versus non-verbal, some non-verbal tools can be used, like the use of color coding assignments, like the using of charts and graphs, like the using of different color of scraps and so on. So this is an example of using different tones in the same sentence. Here I can say, I know who mixed the files. While I can say in different way, I know who different files, who mixed the different files or these files, pointing to someone. This is different, the same sentence, the same words, but I'm saying in different tones. So I'm delivering different messages. What do you think also about this? Let's eat kids. While I can say it, let's eat kids. The first sentence show me as a vampire or something like that eats kids, okay? But the second one that I'm telling my kids, let's eat, okay? So the pause here made a different message using the same words. So the standards of effective communication are mainly 4 standards. The communication should be complete. It should communicate all the relevant information and leave time for questions. While it should be clear to convey information that is plainly understood. It should be brief. Don't give so much information, and it should be timely. Don't be so late. So an example for complete, do you have any question? Ask me any question if you have, and that's what I am doing to you now. Do you have any question in the previous session or in the previous slides? Do you have? Okay, thank you. Okay, it should also be brief. The communication should be brief. So all and only what you want. It should be clear how X is X, and it should be timely from receiver perspective, not only from your own perspective. Okay, so let's ask you a question. Is this communication clear? Can you answer in the chat? Yes or no? Is this communication clear? No. Okay. Is this communication brief? No. Okay. Is this communication timely? Yes or no? Who said yes? Is this communication timely? Who said yes? He put this sign after the people already, the warning sign, he put it after the people already down in the water. Is this communication complete? It's missing the E. Okay. So what do you think? I need your answers also. What do you think the communication challenges are? What can be a communication challenge? Okay. What do you think? Communication challenges or barriers? Language barrier. Thank you. What else? What do you think? Culture. Amazing. Clarity of information. Tone of voice. Okay. Different minds, different personalities. Very good. Route of communication. So now, language barrier number 1, as you just said, distractions in the field of work. Physical proximity can affect the communication, different personalities. Amazing. The workload can affect the communication so much. The varying communication styles between people, the conflict, even if personal conflict can affect directly the communication and then the patient safety. Lack of information verification, and also like shift changes. Okay, so we will talk now about 4 main strategies that can overcome these barriers and can be used to as information exchange strategies. The first one is the XBAR, then the call out, then the check back, and the hands off. Did you hear about XBAR before? Yes or no? Yes, for sure. Most of us, or nearly all of us. Okay, the XBAR is not a form, it's a technique. It's a technique that is a better way to deliver information. The S for situation, the background, the B for background, the A for assessment, and R for recommendation. So the situation, what is the situation? I should deliver the situation of the patient, and also the background or the history or the clinical background of the patient. What is the problem with the patient? This is the assessment, and what do I recommend or what can I request to be done for this patient? Okay, can you elaborate steps? You mean the word TeamSTEPPS. TeamSTEPPS is team, okay? Then steps, team strategies, the S for strategies and tools to enhance performance and patient safety. This is for TeamSTEPPS, okay? So what about the call out? The call out is used in emergency situations. It is used to deliver. It informs all team members simultaneously during emergency situation, and it helps team members to anticipate next step. Let's watch this quick video.
Dr. Dean, it looks like these decelerations are getting even more severe.
Dr. Dean, do you think we should consider C-section? No, not yet. Anyway, this looks okay.
Dr. Dean, the baby's heart rate's been in the 60s.
Let's continue to monitor.
It's been like this for 3 minutes.
So, sorry, as you just said or watched in this video, okay?
Dr. Dean, it looks like these decelerations are getting even more severe.
Excuse
Do you
me.
think we should consider C-section? No, not yet. Anyway.
As you just watched in this video, what do you think? How did the call out aid the team? So the team members verbally confirmed critical information about the presence and duration of the decelerations, okay? Also, the team was anticipating future actions, including a possible C-section and call to attending. Information was directed by name to Dr. Dean for response and feedback. So what's checkback? In one of the answers from you, you said closed loop. So checkback can close the loop of the communication. So the sender initiates the message, then receiver accepts the message and provide feedback confirmation, and then the sender verifies message was received. So when you are ordering an order in a cafe or McDonald's or so, okay, so you give your order to the receiver, then once tell he or she confirms the order, then you confirm and saying correct or okay. And if there is a mistake in the order, you will correct it for him or for her. Let's see this quick video for
Calcium gluconate diluted in 100 milliliters of normal saline IV for an hour.
To confirm that 1 gram calcium gluconate diluted in 100 milliliters of normal saline IV over an hour.
Correct.
So as you just watch it, correct. So he has to close the loop. Okay. So what about the hands off? The hands off is the transfer of information during transition in care across the continuum. It includes the opportunity to ask questions, clarify, and confirm. And we can watch this video to illustrate more what's the hands-off.
Hi, Carla. This is Liza Colby, one of the RNs down in recovery room, ready for report on Dr. Daniel's patient. This is Angie Peters. Angie Peters, 54 years old, going to room 416, bed 2 on 4 East. Status post total thyroidectomy this morning, doing well now. BP 120 over 85, heart rate 80, temperature 37 degrees Celsius. O2 is up to 97% on 2 liters, and pain is 2 out of 10. Surgery was remarkable for a large thyroid, no pre-op issues. She's a Jehovah's Witness, so no blood products, but she is a full code. Her advanced directives are in the front chart. We have one safety concern, hypocalcemia. Dr. Daniels, the attending, ordered calcium levels Q12 hours because she's worried about possible hypocalcemia. So monitor pins and needles, muscle cramps, and shortness of breath. You'll need to review these symptoms when she's fully awake. Normal saline IV is running at 100 cc's per hour. Meds are metoprolol, 50 milligram prior to surgery, and we just gave her 4 milligrams of morphine. Urine output is good, Foley's to be DC'd in the morning. I'll let transport team know to ask for you. That is Carla Lopez, right? What else can I tell you? Yes, that's right. You've got all the information right. Good question. There are no known drug allergies.
So she gave her the opportunity to ask a question, and this is very important. And sometimes it's missing during our communication and during our hands-off. Allowing the field for questions is very crucial to patients. Okay, so hands-off consists of to transfer of responsibility and accountability, and it should contain clarity of information and ensure also verbal communication of information. It should be acknowledged by the receiver, and to give the opportunity to review and ask, do you have any questions? So let's discuss this. What do you think, which is which? Code blue, consultation, phone order, shift change. Which of these we use? XBAR, we use call out, we use checkback, we use hands off. So regarding the code blue, what is it? Are we using XBAR, call out, checkback, or hands off? What do you think? B, call out. B, call out. Excellent. What about consultation? A, XBAR. C, consultation, C. By the way, very good. We can use both. Mainly we use the XBAR, and we better if it is by phone or verbal consultation, it should be checkback, but mainly XBAR, because most probably the consultation is on the system. So I should deliver the information, but maybe I don't have the chance to have a checkback. So what about the phone order? What about the phone order? Checkback, okay. And then the shift change, for sure, we use the hands off. Thank you. And also we can use the XBAR, but mainly the hands off. Thank you. So now we discussed some barriers of communication, and we discussed mainly 4 tools and strategies to overcome these barriers. This is all to reach our outcomes related to shared mental model, adaptability, team orientation, mutual trust, team performance, and patient safety. Now we will move on and go to another module. It's leadership module. Do you have any question regarding communication so far? Is it clear for you? Yes or no? Thank you. Is information clear for you? I'm now doing what I'm saying. Do you have any questions? Thank you. Okay. So now we will talk about leading teams. So now you are in a team and you are a team leader. So how, sometimes, by the way, as we are going to discuss, sometimes you might be a designated team leader and you might be a situational team leader. The situation made you the leader of this. So the skills of leading teams should be, we are all should be aware about these skills. So we will describe how leadership affects team processes and outcomes and identify different types of team leaders. We will describe the activities involved in successfully leading teams. We will describe the tools for leading teams, including briefs, huddles, and debriefs. And we will apply these tools to some scenarios. So, definitions of leadership center on the concept of influence. This is leading teams is a process whereby an individual organizes and influences a group of individuals to achieve a common goal. As Dr. Ahmed said in the team structure module, the difference between team and a group is that the team has a shared or a common goal. And the role of the leader, one of the role of the leader is to achieve and help this team to achieve this common goal. So leaders influence team effectiveness by facilitating the team actions. The leader should help the team to achieve their goals, to ensure that teams have necessary resources, to ensure that rules and tasks are understood, are clear, are distributed in a manner that will achieve the common goal, and to be knowledgeable of team members, to be a role model for this team. Okay, so the leadership holds the teamwork system together and ensure a plan is conveyed, reviewed, and updated. Also facilitated through communication, continuous monitoring of the situation. That helps the leader to achieve his or her action. Also fostering an environment of mutual support. So as we just discussed, the types of team leaders designated and situational. Designated, like the person assigned, the manager assigned to lead and organize a team, establish clear goals and facilitate open communication and teamwork among team members, like nursing director or manager, and so. While the situational leader is any team member who has the skills to manage the situation at hand. I need your answers. What do you think the situational team or the situational leader can be? Like what situation? Like in which cases? What do you think? Disaster, crisis, cardiac arrest, code blue, emergencies. Excellent. RRT. Thank you. So the effective team leadership can be done through these steps. The leader should know how to define the plan and how to assign tasks and responsibilities, how to use the effective tools of leadership that we will discuss, briefs, huddles, and debriefs, how to make conflict resolution if there is any conflict between members of the team, how to promote and how to be a role model in the team. So in defining the plan, when developing a plan, the team leader should consider the time, the people, the equipment, and the information. How much time is available to complete all the tasks? He shouldn't give a task to be finished in 5 minutes and give it 2 hours, and the contrary. Also to consider the people. Do the available staff have the necessary knowledge and skills to perform the roles? What about the equipment? Is the necessary equipment available and working? What about the information? Has all the necessary information been collected and reviewed? While the second rule is assigning tasks and responsibilities to determine the tasks and rules to be assigned and to determine which role must be filled and to allocate tasks appropriately. So when I know that X person is skilled in so and so, I should give him the task that fits his skills and try to improve also his skills in order to achieve other tasks. The leader should know how to communicate clear expectations of what team members need to do, and also to allow the field to request feedback from the team members. So these are 3 tools that can be used from leaders as effective tools of leadership: the briefs, the huddles, and the debriefs. So as a plan, it should be the briefs. As a problem solving, we can use the huddles, and as to improve over time, we can use the debriefs, as we are going to discuss now. So leaders are responsible to assemble the team and facilitate team events. Anyone can request a brief, huddle, or a debrief. Okay, so a briefs sharing the plan. The team briefing is an effective strategy for sharing the plan. So now you have the plan and you want to share it to the team members. So the brief should help to form the team and to designate team rules and responsibilities, to establish climates and goals, and to engage a team in short and long-term planning. Let's watch this small video regarding the briefs.
Okay, she currently only has intermittent late decelerations and needs to improve with her position changes and supplemental oxygen. We'll monitor her until she's fully dilated and allow her to push. If there's any evidence of fetal distress or persistent late decelerations, we should be prepared to go to C-section.
I've alerted the R to prepare in case we need to use it.
Great. I'll discuss this plan with Mrs. Keys when we're done here. What are her vitals right now?
Normal, just checked 15 minutes ago.
She's had no late deceleration since you recall. Let's continue to monitor her. I need to know when she's complete and pushing so we can keep a close eye on her second stage. Any questions?
So this is, what do you think about this video? Was the leader using the briefs in a good way? Yes or no? What do you think? Yes or no? Did the leader use the briefs in a good way? Did he deliver the information in a good way? Did he allow the field for questions at the end? Thank you. So one of the tools that is used in the briefing is the briefing checklist. Using this checklist is to plan and manage the briefs. And it includes the following. It's composed of some like questions. It should clarify who will lead the team first, and open the lines of communication among the team members, and set the tone for the upcoming slate of patients. Establish the protocols, responsibilities, and expected behaviors. Prepare the team for the flow of the day and specify expectations. Like this question, who is on your team today? All members understand and agree upon goals, rules and responsibilities understood, staff availability, workload, available resources, review of the days of the patient. So what about the huddles? The huddle is the tool used to monitor and modify the plan. So now we conducted the plan and communicated it to the team using the brief. But now we are during our implementation of the plan, we have a situation that made us try or want or urged us to change the plan itself or modify the plan. So it holds ad hoc or touch base meeting to regain situation awareness and discuss critical issues and emerging events. And it anticipates outcomes and likely contingencies. And it assign resources and express concerns. Let's check this video about the huddles.
Here's this electrocardiogram.
Those looks like it could be the 3 MI. All right, everybody, hey, let's huddle up before we go in, so we know what we need to do.
Well, I've got the 4 liters O2 by nasal cannula to aspirin. He's hypertensive, so we might want to drop the nitro. He's already on the monitor.
Good catch, Karen. Hold the nitro. Where are his cardiac labs?
Labs are pending. We should have those in 15 minutes.
Okay, let's prepare to get to the cath lab immediately. I'll call the cath lab. Okay, all right, let's get in.
So as you can see, that the ECG changed the plan itself. So they had to make this quick meeting, which is the huddle, to deliver the message that we will change the plan or modify the plan. So please don't leave gold on the ground. What do you think the gold that we mean? What do you think? Please don't leave gold on the ground. Okay, so what we mean by gold is the lessons learned. Please don't leave the lessons learned. We should document and learn from our areas for improvement. And how can we do this? We can better do this through the debrief. So reviewing the team's performance or the process improvement using the debriefs, it should be brief, informal information exchange and feedback session. It occurs after an event or shift. It's designed to improve teamwork skills, designed to improve outcomes. It's not an area for blame. It's an area for improvement. So also the debrief can have a checklist to ask if communication is clear, our roles and responsibilities were understood. So we are talking now after the event occurred. The situation awareness was maintained. The workload distribution was intact. Did we ask for or offer assistance? Were errors made or avoided? What went well? What should change? What can improve? So now let's check for this debrief video.
Great job, everyone. Can we discuss how things went today with Mrs. Keys? What did we do well and what can we do better next time?
It was helpful for me to be brought in early. That allowed me to use a regional instead of a general anesthesia.
You're right. Lynn, what did you think?
It was great that Dr. Dean helped with the polling play.
Okay.
Thanks. Well, I didn't count with Alicia.
Albert, this is a great example of task assistance. How was our communication today?
So what do you think about this video? Was it talking only about errors that happened? What do you think? Can you answer me in the chat? No. Excellent. What's the good side that the leader here emphasized and points on? Good things. What goes well? Exactly. So in the debrief, we discuss what went well and what didn't go well, not only what didn't go well, okay? This motivates the team, and this also motivates us to better achieve better results. So before we do the briefs, in order to make the plan and to communicate our plan, to share the plan, while during, if we have a change in our plan, we use the huddle to monitor and modify. After that, we use the debrief to review the team performance. So also one of the rules of the leader is facilitating conflict resolution, and this is very important. The effective leaders facilitate conflict resolution in order to avoid compromising patient safety and the quality of care. And they should never allow interpersonal or irrelevant issues to negatively affect the team, and help team members master conflict resolution techniques. The fifth rule of the leader is to promote and model teamwork. So the effective leaders cultivate desired team behaviors and skills through open sharing of information and role modeling. The leader should be a role model. He's not only working like that and that, he should be a role model. He shouldn't tell them something while he or she not doing it. So should be constructive and timely feedback, facilitation of briefs, huddles, and debriefs, and also conflict resolution. This helps in mitigation of conflict within the team. So as a review, effective team leadership has mainly 5 roots: defining plan, assigning tasks and responsibilities, using the 3 tools, conflict resolution, and promoting and modeling the teamwork. So now we discussed the barriers, we discussed tools in communication and leading teams in order to achieve our outcomes. And now I'll move to Dr. Muhammad Imam to talk about situation monitoring. Thank you. Do you have any questions regarding the previous sessions?
Thank you, Dr. Muhammad. I think I will have some questions in the question and answer. So I have one question for you and one question for me. And I think some other question I can answer it quickly. So let me ask you first, Dr. Muhammad. I have a question here from one of our participants. What's the difference between SBAR and handoff?
Okay. So SBAR is a technique that can be used in many of our situations. It should include 4 main items. It should include the situation, the background, the assessment, and the recommendation. So why you can use the SBAR during the hands-off, but you cannot use the hands-off only during the SBAR. So SBAR can be included in the hands-off, in the consultation, in the delivery of any information. The case only that it's hard to use the SBAR in is in case of like call-outs in the emergency situation. You don't have this luxury to deliver all the situation, background, assessment, and recommendation. You are delivering an urgent information. You are in an emergency situation. So the SBAR can be used in many situations, like we just said, while the contrary is not right.
Excellent answer. Thank you very much for the answer. So I have some questions here about KPIs. Actually, the KPIs is beyond the scope of this presentation or this workshop. So the KPIs is performance monitoring tool, but here we are focusing mainly on how can we make the team performance better. So maybe we can take time next webinar or next event to answer some questions about the KPIs. I have one question here to me. It's actually directed from Tahira Jaira, and she's asking me how can we implement TeamSTEPPS in improving OR performance. So simply as Dr. Muhammad Tawansi described here, we can use the briefing, we can use the debriefing, and we can use the huddle. So many tools can be used here in OR to improve the performance. So briefing actually is a simple technique, can be used in the early morning just to set all together, review all cases, and check if there is any important task we should focus on, or we can improve, or we can do. And from this, we can proceed for the whole day. At the end of the case or at the end of the day, we can do the debriefing. The debriefing is another technique that we can check and ask the questions that Dr. Muhammad Tawansi described very well in his presentation. And it's asking what went well, and we can reinforce and make sure that our performance, what went well, can be reinforced the next time. And the other question is, what can we do differently to improve our performance, which is an important question to ask at the debriefing to avoid any like pitfalls or any problems during the day. So this is simply how can we implement. This is 2 examples I gave you for improving the performance in OR using the tools we learned from the TeamSTEPPS. So there is no other question relevant to this part, and now we can.
Okay, Assalamu alaikum. And thank you for having me. Thank you for all our colleagues for their wonderful presentations. Thank you for the Saudi Patient Safety Center and the WHO teams for arranging this magnificent event. Now we're going to talk about one other component of the TeamSTEPPS functions related to improving team performance, which is situation monitoring. Okay, so our objective for this session is to discuss how situation monitoring affects team processes and outcomes. We will be able to list the components of an important tool, which is the STEP mnemonic. We will also explain how situation awareness is affecting team performance and identifies what conditions undermine the team performance effectiveness. And we'll define the shared mental model and how it is cultivated within a team. So as you have seen during our previous presentations, how team structure, leadership, communication, and other components work together to deliver or to improve the performance of teams. And although they seem like some basic functions and basic knowledge for most teams, still, I bet that most of us can name one or more of their team members who, regardless to their level of skill or level of performance, still has a defect in, for example, leadership skills, some communication skills, who are not able to provide support in a timely manner so that the whole team performs properly. So although they are very basic, TeamSTEPPS helps us by providing information related to all these components in small bits that can be easily understood and recalled when needed during performing within a team. Situation monitoring is a continuous process. It starts by the individual starting to monitor the situation and monitoring what's going around him in his environment, going on with his patient, going on with his team members, then sharing this information and sharing this knowledge with the team members. So it starts with situation monitoring for the individual. Once he becomes aware of what's happening around him, he shares this with the team, and the whole team has this shared mental model. Our first tool here is a STEP mnemonic. The STEP mnemonic here for each word of the STEP, it stands for a bit of information that collectively leads to a complete awareness of the surrounding situation. The first of which is the status of the patient. The second is the team members. The third is the environment. And the fourth is the progress towards goals. And before starting to identify each one of these, just a quick question. So who of this team members should be responsible to monitor these elements? What do you think? Is it the team leader, the most senior team member, the most junior team member, the nurse in charge? Who is responsible to monitor these elements? Okay. So I can't really see if we're having some answers here. Okay, so let us, very good, the leader, team leader. Okay, we have a couple of more answers. All team members, thank you. Team leader, everyone, leader. Excellent, excellent answers from our participants. It's actually all team members. And although the leader is responsible to providing direction, but all team members, including the nurse in charge, the junior or senior team members, all of them should be collaborating together, because every one of them has a bit of information. Sharing this information and monitoring all these elements together leads to this collective knowledge and this shared mental model between the team members. Okay. So situation monitoring is the process of actively scanning the behaviors and actions to assess elements of the situation or environment. It enables team members to identify the potential issues or minor deviations, and it helps the team to foster this mutual respect and team accountability. It provides a safety net for the team and the patient and includes cross-monitoring. So it's only logical that once you are able to communicate all this information, your teams will act as a backup to you. They will act as your safety net. They will all help you to achieve this ultimate goal of providing a safe patient care. An example for this is, for example, in the first situation, a respiratory therapist notes that a ventilated patient is showing a marked increase in respiratory rate that might indicate an increased level of pain that cannot be communicated. So here, the respiratory therapist has an eye on the status of the patient. Okay, so this is an example of monitoring the status of the patient. In another example, the patient's nurse is busy helping another patient, and the rest of the team members are monitoring this. So again, here we are monitoring the team members. Team members are monitoring each other, and a great difference here between monitoring team members to reach our goal of safe patient care and spying on each other. This is only aiming to help the team member to function properly. Another example, during a shift change and everyone is busy checking the medication record, and you note that the patient is overdue for his morphine. So here we are monitoring the environment, the situation happening around us. So everyone is busy because they are having this handover, they are shifting between shifts, and everyone is busy. So here we have an eye on the environment. Progress toward goal unifies oncoming nurse of your concern. So this is your progress, the next step you take in order to make sure that you are progressing forward toward your goal. So here we'll have two short videos on the status of the patient and the team members, and how monitoring these two elements can help us reach our goal of safe patient care. Dr. Mohammed, can we please run the videos? Dr. Mohammed. I think do you all hear the voice, or is it not clear? I think we need to unmute the microphone. Can we please? Yes, we need to unmute the microphone.
Cruise? Oh dear, I need to get my cat Hobbs to the vet.
Is there something wrong with your cat?
So in the first video here, you can see that.
I'll see you tomorrow.
Okay, so in the first video here, you can see that the attending nurse, he didn't only just do his job and going his way. He participated in providing this safe patient care by having
Dr. Imam, you're muted.
Okay, sorry for this. So instead, so in the previous video, if you didn't hear me, in the previous video, Greg didn't just do his job, didn't withdraw the samples and just head on his way. He participated in achieving this safe patient care by also monitoring the status of his patient. So monitoring this status and delivering this information to the rest of the colleagues helped all of them to achieve their ultimate goal. So monitoring the status of the patient. Can we please have the second video, please?
He wants to induce labor with this approach to intervaginal. I think he wants 100 micrograms.
Actually, Dr. Dean, I see the order says 25 micrograms was the cost of intervention.
Oh. Right, it is 25 micrograms. Good catch, Dr. Baum.
Okay. So in our second video, you saw how a team member kept an eye for the information being communicated by their team members and corrected this information in a respectful manner. And we'll learn more about how to communicate safety issues on our next presentations. And now we have an example of how the monitoring of the status of the patient and monitoring team members can lead to achieving our goal in improved patient safety outcomes. For the status of the patient, some examples that can be monitored is the patient history, the vital signs, the medications, the physical exam, the plan of care, and the psychological condition of the patient. For the team members, we monitor each other for signs of fatigue, signs of workload, signs of task performance, and skill level and stress levels. These are all items that can be monitored between team members to be able to assess their ability to provide their best performance. Cross-monitoring is the process of ongoing monitoring to recognize risk or unfolding error. It's a good opportunity to interrupt or correct an action or event before there is harm or injury, like exactly what we have seen in the previous video. They help each other and they watch each other's back. They watch each other back if there is an error or an issue that needs to be corrected. Team members will help each other and notify each other about any probable issues. Providing feedback to ensure that the procedures are being performed appropriately. And as we were saying, it's not a way to spy on team members, but just a way to provide a safety net for error prevention. A good checklist, and this is our second tool that we will be talking about today. A good checklist that we'll be going to use is the I'm Safe checklist, okay? And again, you don't have to go around carrying this checklist, just checking it every time you interact with your team members. It's just a mental model that you need to develop so that in every interaction, you automatically check these issues. So the I'm Safe checklist stands for, I stands for illness, M stands for medication, S stands for stress, A stands for alcohol or drug consumption, F for fatigue, and E for eating and elimination. So during this cross-monitoring and even during monitoring yourself, you have to check, okay, so is my team members suffering of any illness? Are they on any medications that's affecting their judgment? Do they show signs of stress, maybe issues outside the workplace or inside the workplace? Are they on any sort of medication or alcohol or drugs? Do they show signs of fatigue, maybe after a long shift or after long hours of service? Sometimes they start showing show signs of fatigue. And even the basic needs of eating and going to a washroom, all this are issues that may affect the individual performance. So it's a good mental model to follow in order to check that the rest of the team members are performing properly. The environment, some elements of the environment that can be monitored include the facility information, any administrative information, any issues related to human resources, to triage, equity, to the availability or the functionality of equipment. Then finally, we have progress towards goal. Once you are able to identify a certain issue, you start by progressing towards a solution. You call for a huddle, you check the status of the patient, you go for adjusting the goals of the team, and check if the plan is still appropriate to the patient or not. Situation awareness is the state of knowing the current conditions affecting one's work. This includes the status of the patient, status of other team members, environmental conditions, and progress towards goal. So I hope now that we have a clear understanding of this. So what are the situations that might lead to decreased situational awareness? And let's just take a couple of minutes here to think about it. Okay, so when is our awareness of the situation and our environment around us is can fail and cannot reach its goal? So conditions that undermine situation awareness include the following. For example, the failure to share information with the team. If, for example, there are conflicts within the team, if there are issues preventing you from feeling comfortable around your team members, or they undermine the work, or if there is any other condition between team members that leads to failure to share the information with your team members, failure to request information from others, failure to direct information to specific team members, failure to include the patient or family in communication, failure to utilize your resources fully, failure to maintain proper documentation, failure to know and understand where to focus attention. All these are factors that lead to decreased situation awareness. Failure to know and understand the plan, failure to inform team members the plan has changed. Some examples where failure can occur in the STEP process include the failure to take a patient's vital signs. This is failure to assess the status, failure to assess a team member who you know is overloaded. Again, this is failure of monitoring the situation of your team members. Failure to know where the necessary equipment is stored. Again, here, failure to keep an eye on environmental conditions and availability of equipment, and failure to progress toward goal, where you fail to call a huddle and update the team when the plan has changed. All these are examples where failure of the STEP process leads to decreased situational awareness. A shared mental model is the perception of or the understanding of or knowledge about a situation or process is shared among team members through communication. So once all information regarding a patient is shared within the team members, they all develop this shared mental model. So can you tell me if in this picture there is a shared mental model between the team members or not? Okay. Very good. Very good, very good. So most of you can see that there is a clear and obvious missing shared mental model, either due to a lack of communication of information or other team issues, since that this guy standing in shorts here does not recognize the hazardous condition in which they are operating. So we'll have here a small practical exercise, and here we call for all ER physicians, ER nurses, anesthesiologists, everyone working on contingency teams. We'll just share some information regarding 3 patients, and we'll see how sharing information is important for their outcomes. So here we have 3 patients. We have the orders for this patients and the vital signs for these patients. Okay, so we will have another slide showing more information about these 3 patients, and you will help me to triage these patients according to urgency of situation. Okay, so for Jackson here, you have the EKG, the oxygen, cardiac enzymes, and so on, and these are the vital signs, Simons and Bailey. I'll give you a couple of minutes. Okay, so some more information regarding our patients. Patient Jackson is a 23-year-old male. Patient Simmons is a 19-year-old female. And patient Bailey is a 76-year-old male. Okay, so can you help me triage these patients? Okay. So keep this solutions in mind. Now we'll reveal some more information regarding these patients. Patient Jackson is a known cocaine user with chest pain, and you are concerned about a possible MI. Patient Simmons is hypotensive and experiencing tachycardia, and you are concerned about a ruptured ectopic pregnancy. Patient Bailey has tachypnea, tachycardia, and fever, and you are concerned about pneumonia. So do you still have the same exact triage you had before? Before revealing this last slide, do you have still the same? Okay, very good. So most of you have changed their, yes, very good, very good. Most of you have changed their triage for these patients once more information has been revealed. Very good. Okay. So shared mental models helps the teams to lead to a mutual understanding between the team members about the situation. It leads to more effective communication. It enables backup behaviors, help ensure understanding of each other's roles and how they interplay, enable better prediction and anticipation of team needs, and create commonality of effort and purpose. As you can see, it's a continuous process. Situation monitoring for the individual leads to his situational awareness. Once he is aware of the situation, he shares this with the team, leading to a shared mental model between the team members. So this is our third tool and a third component of the TeamSTEPPS. We have now learned about communication and the 4 tools within the XBAR, call-out, checkback, and handoff, leading teams and the briefs, the huddles, and the debriefs, situation monitoring, and the step mnemonic, and the I'm safe checklist. This is all for this session, and now we'll move back to Dr. Ahmed Sheikh and the mutual support session. Thank you all for your time.
Thank you so much. Thank you, Dr. Dr. Imam, and thanks for our participants. MashaAllah, we're keeping the participants all the time since the start. Thank you so much for being here. And now it's time to talk about the mutual support. Now you brought the team. We knew about the team structure, and you now understand the situational monitoring. What about how this team is going to interact together? The mutual support is really important for the team to be a team. Remember our discussion earlier about, okay, so what's the difference between the team and the group? This is what really differentiates between a team and the group, if they can really interdependently working together. There are several tools that can you say that you have a mutual support. When members assisting each other, you have a mutual support. When they provide and receive feedback properly, they have mutual support. And when they have assertive and advocacy behavior, when patient safety is threatened, as long as we are patient-centered, this is mutual support. So instead of talking about situations that may look like mutual support, which one of these do you think that we can call this is a mutual support? 1, 2, 3, or 4? Use your chat, write your feedback. Which one do you see that there is mutual support in? The first and fourth. All. Are you sure about the third? Okay. Let's see. We return back to this. The first thing, or the first tool that you use in order to have mutual support in place, is the task assistance. The task assistance simply is when the team is actively offering help to each other. Let me show you a very brief video here that will show you what is the task assistance.
Olivia, get the O2 and call Gail for the emergency cards.
Olivia, I'll call Gail. You go get the O2.
Olivia, apply 2 liters.
Apply 2 liters.
Correct.
I called Gail. She's on her way with the emergency card. I also called Lucy to transport Mrs. Adams back to her unit.
Great. Thanks, Jay.
So as you see here, Jay provided help without even being asked for. He was eager to help the team. He was eager to be there to provide the mutual support. So he actively offered the help, and he made a very important point, which is closure of the loop and informing them that he did the task. This is the first tool that you use for the mutual support. The second one is the feedback. Feedback is really important. It's the information you provide to the team in order to make sure that the loop was closed, or at least to provide that you have a point. We are providing feedback every time. Feedback in terms of formal or informal feedback. In the hospital, when you have a committee, or when you have the meeting, or you have performance reviews, this is formal feedback. But this is mostly retrospective. What we're seeking more is typically the real-time feedback. This does not mean that the formal is less important, but the informal is more real-time. It's providing on ongoing basis, just like the huddles, the briefs, the debriefs, all that you saw in the previous videos. And why don't we check another simple video?
I'm Carrie Feldman, Mrs. Edwards. Hi, I just wanted to say you did a great job with the heads up on this effort the other night. Amy said she might have realized Edward was getting so sick if you hadn't spoken up.
Sure thing. Thanks.
Amy mentioned there's a nurse managers meeting next week. I thought what you did would be a great example of effective communication and teamwork to spread across our units here. Would you mind talking about what you did?
No.
This is a very brief example. If you didn't catch what they were speaking about properly because of the sound, she was thanking him about the situation that he just did in the previous session, that he discovered an issue with the patient and he spoke up to the team, and this interfered with the patient care. The good thing here is the feedback. She provided feedback to her colleague, which is the nurse, and not only that, she asked him if he can provide this case to his colleagues in order to praise his work and to emphasize the good job. So the effective feedback, it should be timely, respectful, specific, directed towards improvement, help to prevent the problem, and should consider. Simply, this feedback, it should be provided in a timely manner, in a respect, because we are one team and we're focusing on improvement. Let's remember that we are the patient advocates and we're trying to prevent the next problem. The third tool is the advocacy and assertiveness. Assertiveness and advocacy is very simply when you provide your concern, if you have a concern, in a very respectful way and very firm way. Think of a nurse in an endoscopy unit who saw something during the endoscopy and providing the feedback to the physician. She can simply say, this is not my job. He is the physician, he's the boss. Or she can say, doctor, I saw something strange that we need to pay attention to. And if he is a real team member and listen to the concern from the colleague, this may help the patient a lot. So assertive statement, to provide it, you have only simple 5 steps. Open the discussion with the name in order to gain the attention, state the concern very clearly, state the problem, offer a solution, and obtain an agreement. Why don't we see again another short video?
He wants to induce labor with this approach to intervention. I think he wants 100 micrograms.
Actually, Dr. Dean, I see the order says 25 micrograms was the process.
Right, it is 25 micrograms. Good catch, Dr. Fong.
As you saw here, the message was very clear and the message was very assertive, very precise, and he could help to stop an error. The fourth way is the 2-challenge rule. Simply the 2-challenge rule, in order to make it simple and short. Let's see this video and what do you think about it?
We have a ranger coming in injured in a 30-foot fall off the tower. He's unconscious and intubated with bleeding from the right ear. He's got bilateral femur fractures. ETA is about 3 minutes. I've activated the trauma team.
Do you want me to call neurosurgery and ortho?
Not yet. Let's get some blood tubes and IV fluids.
Bridgeton, we've been asked to give consultants a heads up as soon as possible. I think we need to notify neurosurgery and ortho.
You're right. Go ahead and call.
So they are expecting to receive an RTA, and the point here is the nurse stated her concern very clearly in terms of question. Do you want me to call for the ortho and neurosurgery? Once her concern was not heard, she stated clearly, we've been asked to notify them ahead of time. And what was the feedback? Yes, you're right. Please do it. This is called the 2-challenge rule. So you raise a question, then you take a stronger course of action, even that you use supervisor or chain of command. So what if your concern is not heard? Now you're going to use another tool called I'm concerned, or the CUS word, the CUS abbreviation. I'm concerned, I'm uncomfortable, and there is a safety issue. Let's see how this is implemented.
Dr. Dean, I'm concerned about Ms. Keys. I'm uncomfortable watching these late decelerations, the baby's heart rate's in the 60s. I mean, I just don't think it's safe to continue labor.
So 3 words were mentioned here. The first one, I am concerned, with a clear concern. Then I'm comfortable, why I am concerned about this concern, and clearly this is a safety issue. You're directing a message to someone else, to one of your colleagues, to one of the team members, of your concern, why you are uncomfortable, and if this is a safety issue. A very common question that rises here, okay, this is called informational conflict. So there is something related to the information. So we can use the 2 challenge rule or the CUS. What if there is something interpersonal? What do you think? What should we do? So if there is an issue there is an issue with the team, and you think that one of your colleagues is not doing the proper care for the patient, how should you treat this situation? Let me give you a situation. If a nurse is, if a senior doctor seeing a junior doctor is doing or trying to insert a tube in a wrong way for the patient, how can he provide the feedback? This situation may happen and we should be ready. What are your thoughts? Please write it in the chat. Most importantly, this should be in private and you should follow these steps. Describe the specific situation. Why do you think that there is an issue? Express your concerns about the action, suggest other alternative, and make sure that the consequences to be stated. So you describe the situation very clearly. I am concerned or I'm worried of what happened because of the way that you talked to me during the huddle. I think that this may not be productive. I suggest if you have an issue with the decision that I make, to speak in private, and next time I may ask you about your feedback during the huddle. See, you're expressing the situation of, okay, so what should we do, especially if there is an interpersonal issue. So make it timely, aim for a win-win, frame the problem clearly, use an I statement, focus on the critique, not the criticism. Do not point finger to the person, and focus on what is right, not who is right. Now we're done. We're done of all the tools and the strategies or those that the time allowed us to do, because usually we provide this as 3 full extended days of training and full of interactive workshops in order to practice these tools. I would like to finish the training with a very short 3 minutes video. And please think of the way that they are handling the patient care in this video. I will leave you. I may pause at a moment or another in order just to elaborate on some points. Let's see. So a lady, 54 years, underwent thyroidectomy, removal of the thyroid, and after the post-operative care, you're going to see.
Mrs. Peters still seems a bit groggy. I'm running up the floor to see our discharges. I'll be back in about 15 minutes. And she did well. She should be able to go home by Friday. Let's keep an eye on her calcium. Will she be going to the floor soon?
Yes, I'm about to start recording.
Great. So maybe just break it.
Please notice that this is the normal life. This is how we endorse the case, or how they endorse the cases to each other. This is a physician post-op, and she's the nurse who's taking care of the patient. Think of the tools. Did she use the tool properly? Please mention in the chat.
Hi, Carla. This is Liza down in the recovery room. I'm calling about Dr. Daniel's patient, Miss Angie Peters. She is stable and ready to come up to the floor. She just had a big goiter removed, and she's 54 years old. No major medical problems except for hypertension. Vitals are stable. Pain score is 2 out of 10. She has no drug allergies. Dr. Daniels, the attending, wants to keep an eye on her calcium. You know, she might be a teacher or something like that. Anyway, do you know which bed she's going to? She should be ready to go in about a half hour.
Which tool would you have expected her to use in this type of communication out of what we saw? Hands-off or XBAR? XBAR. Thank you so much. Was it structured? Have you seen a structured XBAR? No, it wasn't structured.
Well, your vital signs look good. Now, Andrew, your fingers feeling numb or tingling? Are you feeling any shortness of breath, any muscle cramps?
No, I think everything's feeling fine.
Good. Now, here's your call button. I want you to use this if you experience any numbness or tingling in your fingers, any shortness of breath, or any muscle cramps.
I will.
Okay, now you get some rest, okay?
We've mentioned earlier that the patient is part of the team. What do you think? Was the patient here informed? Did the patient know what she requested? Have she double checked that the patient understood the message? Big no.
Calcium level Q, 12 hours. Huh. That's a little weird. She crossed out the residence order. I wonder why. Oh well. Really, we need to get these orders in so the blood draw gets added to the afternoon. Okay.
By the way, this was a borderline to a panic result.
My fingers feel all numb. It's my dark arthritis getting me all cramped.
Mom, shouldn't the pain medicine be treating that? Do you want me to call the nurse?
It's not that bad. Anyway, I'm here from my neck, not from my arthritis.
Well, if you're sure.
I'll be fine. And you need to get on home. Just give a big kiss to my little angel from Grandma.
Okay, Mom, you get some rest. I'll be back in the morning. Here's the call button. Make sure you wait for help if you need to go to the bathroom. The last thing we need is for you to fall.
Because this patient was not informed, this patient was not engaged. As you see here, they are concerned of the fall rather than the numbness, which is, for your information, is a very dangerous sign for this lady.
What's going on with my mother, Auntie Peters? None of your moms haven't seen her, so doctors are getting her stabilized. They're gonna have this for breathing too much. So they moved up to the ICU. We called Dr. Daniels and she's on her way up. This happened. She was fine when I left her last night. Why didn't someone call me? It just happened. Let's go to the waiting room.
So the last thing that she mentioned before she left was this just happened. I'd like to see your answers. Did this just happen, or was it there as if it is planned for this lady to have this terrible experience? Could we prevent it? Yes, yes, thank you so much. Bad communication, thank you so much. I hope that you enjoyed, we really enjoyed the night with you today on behalf of the whole team, Dr. Khalid, Dr. Tawansi, Dr. Imam, and myself. Really, we enjoyed this. If we have some couple of questions that we can take, Ms. Hiba, the mic is yours.
Yes, doctor, thank you so much. Thank you very much for this informative presentation and workshop. Dear participants, thank you for attending. On behalf of the Saudi Patient Safety Center, we would like to thank Dr. Khalid al-Zahrani, Dr. Ahmed al-Sheikh, Dr. Muhammad al-Imam, and Dr. Muhammad al-Tawansi, and the audience for their active participation. Also, as a part of the Saudi Patient Safety Center efforts to provide you with the timely topics and interesting speakers, we would appreciate if you would fill out the evaluation survey provided at the end of the session. Thank you again for joining us today, and we look forward in welcoming you back in future webinars and workshops.